When a family talks to a healthcare provider, it is essential, it is so important that the family gives the most accurate information to that healthcare provider, because the healthcare provider is going to take that information and then make decisions based on what he or she is hearing. And so that sometimes takes a little bit of forethought from the families and from the patients, thinking about what you want to tell your healthcare provider so he or she can make the best decisions with you in terms of treatment.
Treating IBD for every patient is different. Every patient will come to us with a set of unique symptoms, unique findings when we do our investigations and look for where the inflammation is, what are the characteristics of the inflammation, what is the intensity of the inflammation. And you put all of these things together and you come up with a blend of treatments, many of which are evidence-based, data, clinical trials that have shown benefit for this approach or that approach. I think one key helpful thing that I bring up with my families is to let the family know how will we show that the treatment is working. Partnering with the child, partnering with the family, and empowering them to understand clearly how the treatment would work and how do we measure how the treatment is working well enough or not well enough.
Let's discuss some of the questions you should be talking about with your doctor. Number 1, what were your or your child's first symptoms? How did you first recognize that there was a problem? Knowing this helps you predict what the warning signs will be if you or your child has a flare or increased symptom. Generally, the usual symptoms include diarrhea, blood in the stool, abdominal pain, fevers, oral ulcerations, joint pains, or rashes. Of course, you should note any other symptoms you've noticed and be sure to mention them to your doctor. The severity of these symptoms may vary. Your job is to track the symptoms to determine how well you or your child is doing. Question number 2. How do you best track symptoms? Patients with Crohn's disease and ulcerative colitis track their symptoms. That is, they monitor for disease activity. When tracking, keep a written account of your or your child's symptoms. For example, if the main symptom is bloody diarrhea, make a note of each episode of diarrhea, its consistency, how much blood it contains, and anything else that seems important. Here's an example. Monday, June 17th, 5 bowel movements, mostly watery, with blood in 3 of them. No abdominal pain. Tracking will help you and your child's healthcare team assess the severity of the flare and what treatment is indicated. The level of a flare activity is defined by a specific score, which we will describe in another video. These scores give us a solid idea as to how well a patient is doing, how effective a particular therapy is, or if other therapies should be considered.
So tracking these symptoms helps us and helps our patients understand that some symptoms are indications that the inflammation is active, and some symptoms are just transient, minimal issues that come up that could be tracked to one certain trigger that does not have an implication on the inflammation itself.
It is also important to remember that your healthcare team is made up of more than just you and your physician. Others in your team may include nurses, dietitians, social workers, and psychologists. Each of these team members focus on a specific aspect of your health plan and are there to help you.
It sounds difficult, but I think with an open dialogue with both, with utilizing the expertise that we have on a very advanced inflammatory bowel disease center team, this is where we can make life a lot better for our patients and their families.
As you do better, as your family better understands the diagnosis of inflammatory bowel disease, your confidence, your knowledge, and how well you deal with IBD will continue to improve.